Hiya. So today we're going to talk about basic anatomy of the rib cage. Hopefully I'm going to run a whole series of the skeletal system and then I can link it all together so you have a library to look at. And it's just to give owners a little bit more understanding of maybe what we talk about as therapists. So the horse has quite a large rib cage and it has a huge abdominal cavity, and this is why it has a large rib cage to cover this abdominal cavity. So the horse, the average horse, has 18 pairs of ribs. And you can see here how they start off small at the first rib. They get bigger as they go through to about rib 9. And then they start to taper off and get small again. So we have what we class as 8 pairs of true ribs and 10 pairs of false ribs. And I heard this when I was younger and I never really understood what it was. But what you can see when we turn the rib cage over is here we have the sternal bone. And you can see that these 8 pairs of true ribs actually fit into the bone, whereas the false ribs, you can see, actually come off this last rib and then they come round here, and we call this the costal arch. So in between each rib, you'll have heard of intercostal muscles. So this is called the intercostal space. And often you will see your therapist palpating along the rib or actually going in between the rib because they're going to see how this muscle is doing and is it okay. At the top of the rib, we have the head and the neck and the tubercle, and then this body of rib is called the shaft, and then at the bottom you will see the rib slightly changes angle, and this is called the costal cartilage. Now this is connected by the costal chondral junction, and the bottom is called the sternocostal joints. So what does the rib cage do? So the rib cage provides structure and support for the abdominal cavity, and you can see in the horse it's quite a large abdominal cavity, and this is why they have so many ribs. It also supports the thoracic vertebrae, so each pair houses one thoracic vertebrae and it pops in like this. This is obviously not the vertebrae for this part, but I could only get one. So it sort of pops in like this. So you'll see in the skeletons, and you'll have seen videos of kissing spine. This is a process up here which when you see kissing spine will be fused. So we can think of the horse that sometimes it gets arthritis down below here, that how this affects all the rib cage. So it also protects vital organs like the heart and the lungs, and also houses the diaphragm, so it aids in respiration. And the only way I can sort of think of how to do the diaphragm is, let me just put this in. So it's like a big sail attached to the ribs. So every time the horse takes a breath in, it will breathe up and out. You can see how the rib cage will go up and expand out, and how important this diaphragm is, and how breathing is important for the horse in relation to the health. So then we know about the psoas. The psoas is the only muscle connected to the diaphragm, and the psoas is a really deep muscle. You can't palpate it, but it sits really deep, round about as much as up to rib 14 it will start, and then it will go down as it goes onto the hip. So when we think of breathing in the horse, I don't know if any humans have TMJ issues or teeth grinding issues. Often what we do is we will, because we don't take them big deep breaths, our rib cage will shift up, and often your therapist will advise you breathing techniques to get this rib cage lowered rather than sitting like this. And it's the same with horses. I do lots of breathing techniques, so everything is working fine. So yeah, so if your rib cage is not your diaphragm is not functioning correctly, then your rib cage is not functioning correctly, then your psoas is not functioning correctly, then your hind end is not functioning correctly, and also the front end is not functioning. So it's whole horse. This is why I go on whole horse. So when I'm assessing the rib cage, I will often watch the horse walk away from me. And I will see where this rib cage is. You know, has it got a nice swing throughout the whole body? Or can we see the rib cage more to one side? And often we will see a little bit because of asymmetry and the horse's natural preference to go to one side. But what we don't want to see is this horse stuck like this and not really swinging through. Because again, if the rib cage is not swinging through, the horse is not breathing correctly, and so on and so on and so on, whole horse. So when we look at the front of the horse, often you'll see the photographs that I take. What I'm interested in is where this bone is sitting. Now, I'm not talking about injuries or myopathies or anything like that today, but when we see this angle, sort of slightly over to one side, you can see how everything needs to be addressed, because it's not this what's the problem. It's all of this, and it always starts further back. I've always found that it's always to do with the breathing. So what we want to do is we want to get the horse, even if they're not loading, they need to load correctly, so it's near enough straight. So you can see when you see them before and after pictures of the front end, it's mainly, I'm not thinking of this, I'm thinking, can the horse load correctly? And if I know that's here, we can swing through. And often when I'm assessing a horse, I will get under the sternum and I will get on the withers and I will see if the rib cage can go back, forward, side to side. Because if the horse can't do that movement, then how is it going to walk correctly? How is it going to breathe correctly? So yeah, so I will often ask for a shift of the whole rib cage and make sure. And if I find it stuck, I will keep asking. And often I can find that if I ask a horse to shift its rib cage forward and then it wants to move forward, it means that it's unbalanced. So problems that can occur. Now, horses can have fractures. I think every horse that I've seen on a dissection has some sort of fracture. I also work on horses with fractures. They lead quite a healthy, normal life. They're out competing. Mostly we don't sort of see that unless we can feel. Sometimes we can feel a big fracture. We'll go down the rib and then we'll feel a slight bump or where it's calcified and stuff like that. But also as well, what can happen is we've heard about misalignment in the first rib, but we can often find that these two may be fused, the first and second rib. The first rib may have parts missing, or it may not be there altogether. And if you think of the first thoracic and the last neck attach, how this can be a problem. And again, usually you don't see that till post-mortem. So when we are working on the ribs as well, you can sort of see how the scapula covers a couple of the first ribs. So again, it's quite hard to assess in there. And normally what we will do for the thoracics is we will work along here as a thoracic comes up there. But yeah, I thought I would just show you a little bit about the rib cage. And often you'll see us bouncing on the rib cage. That means because we want that rib cage really, really getting a nice movement. We want to feel movement in all of them. And that's often. And then you'll see a lot of times I will work just slightly behind the rib cage because that's where I'm going to start the diaphragm work. And I'll often wait there a long time to sink in. So yeah. I don't think there's anything. I've wrote some notes because I fluff a lot of the lines. But I hope this helps in understanding the rib cage and why it's important when we're working the horse, we have a nice swing. But not just a nice swing, also the horse can go forward and back with the rib cage. Yeah, so bye.